Dr. Marjan Assefi said, "Have you ever wondered why healthcare in the United States is a hot-button issue? Well, the complexities of the American healthcare system are not to be underestimated. Let's delve into this intricate topic." Dr. Assefi added, "Our journey starts with the startling realization that the United States spends more on healthcare per person than any other developed nation. In fact, in 2023, the US spent an astounding $3.8 trillion on healthcare, averaging approximately $11,500 per person. A significant chunk of this expenditure is funneled towards hospital care and clinical services. But Dr. Assefi asked, "Did you know that over 25% is spent on prescription drugs?" That's right. The cost of prescription drugs in the United States is among the highest worldwide. Now, let's talk about the number of healthcare professionals. There are nearly 1 million actively practicing physicians in the United States. That's about 2.6 physicians for every 1,000 people. Yet, there are areas in the US known as healthcare professional shortage areas, where the patient-to-doctor ratio is an alarming 3,500 to 1. Another key factor in the American healthcare conundrum is insurance. Over 90% of Americans have some form of health insurance, but the system is far from perfect. Approximately 28 million Americans, nearly 8.5% of the population, are still uninsured, but insurance doesn't necessarily equate to affordable health care. Even with insurance, over 60% of bankruptcies in the US are related to medical expenses. That's a sobering reality that highlights the financial burden healthcare can impose on individuals and families. Now let's take a moment to reflect on what we've discussed. The United States spends more per person on healthcare than any other developed nation, yet millions are uninsured, and many insured individuals still face financial hardship due to medical expenses. The cost of prescription drugs is high, and while there are plenty of physicians, they are not evenly distributed across the country. These are just a few of the many facets of the American healthcare system. It's a complex and multifaceted issue with no easy solutions, but understanding the facts and figures is the first step towards meaningful dialogue and change. Dr. Assefi added, "Thank you for joining us on this journey through the intricacies of healthcare in the United States. Until next time, stay with Marie Curie Science Research Center. Stay informed, stay curious."